first I would like to introduce about my topic, that is premature baby or premature birth. So what is basically premature baby or premature birth? So the word is made up of basically two words. One is premature, that means before maturity, and second is birth, which means delivery or birth. So basically what premature birth means, any baby which is born before the gestation period is completed. The normal gestation period, I would like to inform you, is from 37 weeks to 40 weeks. Any baby which is born before that is termed as premature birth or premature baby. Babies who are born after 40 weeks of gestation is known as post-mature birth. So this is the basic introduction for the topic. And now I would like to give a definition. So according to WHO, World Health Organization, premature baby or preterm birth is any baby who is born alive before 37 weeks of gestation is completed. So it is a very simple definition in which you can understand what the topic exactly means. So the next subtopic is incidence. So how common it is among the general public and in the population. So we are going to see that. So according to World Health Organization data, every year nearly 15 billion babies are born premature. So the incidence globally is every 1 out of 10 birth is premature. So that means if 10 deliveries are occurring, 1 out of that 10 delivery is a premature baby. Next, where it is seen more frequently? It is seen more frequently in countries like USA, China, Brazil, India and Nigeria. So you can see the incidence is widely spread among countries which are developed as well as countries which are developing. But another problem which we can see in the incidence is that in India, the rate of premature birth is higher than the global rate. The global percentage is 10, while in India it is 12. So the next subtopic we are going to see is causes or etiology. Why this premature birth occurs? So one of the major reason is related to the mother. So if the pregnancy is complicated, if the mother is having lifestyle which is not proper, if she is having habit of smoking, alcoholism, or she is not taking proper rest and diet, if the mother is having any medical condition like diabetes mellitus, hypertension, or else if in case of pregnancy, like if the pregnancy is a multiple pregnancy, like the mother is carrying more than one child, in case of a twin or a triple. So these are the basic causes. Next, we can see the risk factors. So what are the risk factors? Who are at higher risk of having a premature baby? First, genetic factors. Basically, if the condition runs in the family, there is higher chances that the condition may occur in the future. Next is lifestyle. Anyone who is having habit of smoking and alcohol are having higher risk of getting the disease. Next is obesity. If the mother is obese, she is having higher chance of having a premature baby, as well as if the mother is undernutrition, she still has a chance of producing a premature baby. So next thing we see is pathophysiology. So due to any etiological causes, the placenta is insufficient to carry a baby, due to which there is improper cerebral distribution, which causes reduction in supply of oxygen and protein. This causes reduced intrauterine growth, and this causes low birth rate, and ultimately it leads to premature birth. Now we are going to see the clinical manifestation, that how we are seeing and identifying if the baby is a premature baby or not. First, two very common things which we can see is the reduced length or height of the baby. Okay, so the height of the baby will be less than 45 cm. Okay, and the weight of the child will be below 2500 grams or below 2.5 kgs. These are the most common and frequent symptoms which we can see in a premature baby. The next few symptoms which you can notice is that there will be a large head circumference. Then pinkish skin discoloration will be there. In case of males, the testes won't descend. This is also known as cryptorchidism. Then in females, the labia majora will be widely spread and it won't cover the labia minora. Then coming to the diagnosis. How can we diagnose that whether a child is a premature birth or not? The basic three diagnoses which we have to focus is first, history collection. We have to collect the history regarding the pregnancy. Next, physical examination of the child, height measurement, weight measurement. We have to check the nails, it is discoloration. We have to check the genitals. And the other diagnosis which we can do before the birth of the child is genetic screening. During the pregnancy, this we have to do for the mother. The earlier physical examination we have to ask from the mother, history collection we have to ask from the mother, and physical examination we have to take from the baby. But for genetic screening, we have to do it on the mother during the pregnancy term. So what genetic screening we can do? The most common genetic screening we can do is ultrasound, USG. So coming to the next topic, that is management. So how we are going to manage? Coming to the medical management, we have to give betamethasone, that is injection IM we have to give, that is 12 mg per day every 24 hours. Then we have to give dexamethasone, that is 6 mg per day every 12 hours. Then vitamin K 0.5 to 1 mg per day. Then other solutions, IV solutions we have to give. Again, for surgical management, coming to surgical management, usually for 99% of the case, no surgical management is required. But in case of any complication is there, then we have to do immediate surgical treatment. Then coming to the nursing management, which is most important. First, we have to ensure that the airway of the baby is clear. We have to provide oxygen therapy. Next, we have to ensure that the baby is as close to the mother as possible, which we in medical term we say kangaroo mother care. And then we have to encourage breastfeeding as much as possible so the baby gets adequate amount of nutrition, which can only be given through breast milk. Then we have to ensure the baby is wrapped in a sterile cloth so that he is prevented from any infections or any diseases. Now coming to the prevention. So basically what is the prevention? We have to see the proper lifestyle is maintained. During the pregnancy, the cessation of smoking and alcohol should be done. Then we have to also ensure that if proper family planning is there or not, especially for parents who are having previous family history of the condition. With this, I would like to conclude my topic. Thank you.